Final thing to look at is exercise. So 25% of breast cancer cases worldwide are due to deadly combinations of obesity and a sedentary lifestyle. Exercise decreases estrogen, it enhances fat metabolism, it lessens inflammatory markers, it strengthens your immune system. So based on the evidence, exercise really contributes to reducing that milieu that leads to breast cancer formation. If you already have breast cancer, exercise has been statistically shown to have positive effects on cardiorespiratory fitness, cancer-related pain, mental well-being, depression, quality of life, sleep, fatigue reduction, and breast cancer-related lymphedema. But how much exercise? How much do I have to do to get all the benefits? Well, here's a study. I love this one because it's really setting the bar super low for you. It looked at over 17,000 women, and all they had to do was walk 11 minutes a day. Briskly walk 11 minutes a day to drop their breast cancer risk by 18%. But if you put more pep in your step, women who exercise 3 to 4 hours a week at moderate to vigorous levels in the science will have a 30 to 40% lower incidence of breast cancer than sedentary women. Is more better? Yes, it is. 57% lower incidence for 4 or more hours a week. Because we've seen for many years now, we've known that there's an exercise dose response curve. Exercise and the benefits to health are at their highest impact when you just go from the couch to moving. And it really goes in this exponential pattern to 150 minutes a week. Between 150 and 30 minutes a week, this is pretty steep enough to make me want to push 5 hours a week of exercise. But once you hit 5 hours, you can see it's not a flat line, and it certainly doesn't go down. In other words, there is no end in sight to the benefits you receive from increasing exercise in a weekly level, but the gains are so small that you could actually compute it out and find, depending on how much you exercise beyond those 5 hours, that you gain, let's just say you exercise an equivalent of in the end of your life, this extra bit of exercise beyond the 5 hours equaled 8 months of exercising. You gained 8 months of life. Like, you might just equal out, and all the extra life you got was you actually exercising, which wouldn't be a bad thing either. But my point is, you got to hit 150 minutes, work up to it if you need to, if you can't tolerate that. And 300 is the real gold standard. And more is all like just sugar on top. Okay, so I love this study. 1,340 breast cancer high risk, because they were all stages 1 through 3, and they all got chemo. Okay, and their activity was categorized as inactive, low active, less than 150 minutes a week, moderately active, hitting my 150 to 300, but highly active people, greater than 300, does more equal better. Let's find out. So they were all followed for 2 years, and they found a 55% drop in recurrence and a 68% drop in mortality for all of the exercisers versus inactive. So it didn't matter if you were low, moderate, or high. You, as a group, the active people versus inactive, had this drop. All right, but let's get smarter than that. A 2-year follow-up. If you didn't exercise before diagnosis and you didn't exercise at the 2-year follow-up, you are a reference null person, all right? If you didn't exercise before, but hey, you picked it up, good for you. You're exercising now at 2 years follow-up. You have a 46% drop in breast cancer recurrence relative to the person who's just still sitting on that couch. If you did exercise before, but for unknown reasons or known reasons, maybe in the study, you don't exercise anymore, you still have a 6% benefit over recurrence over the person who never exercised. So good for the before diagnosis days. However, if you're like the super achiever, you exercised before and you exercise now, you have a 55% drop in recurrence. This is even more interesting to me. This is mortality at 2 years. So the person who's sat on the couch forever is our reference person. You didn't exercise before, but you pick it up. You now have a 43% drop in all-cause mortality. You exercised before, but then you stopped. You still have a 9% drop relative to this person. If you exercised before and you exercise now, winner, winner, you get not a chicken dinner, definitely not. Maybe my seitan dinner. 68% drop in all-cause mortality. At 2-year follow-up, we can substratify our minutes now. So the people who did less than 150 minutes had a 59% drop in all-cause mortality, which is statistically identical to the moderate group. Okay, so somewhere between just walking around and 300 minutes of walking around gives you a huge drop. If you're an overachiever, you're rewarded with a 69% drop. Why? Because exercise improves body composition, decreases those sex hormones, including estrogen, improves insulin sensitivity, decreases inflammation, improves the adipokine milieu, decreases the inflammation, right, and all of the secretions, improves immune surveillance, and improves DNA repair. Brand new study in 2023 showed that if you exercise during chemo, neoadjuvant chemo, so your cancer is still in your body and now you manage to exercise and eat healthy, hence the apple. It's called PCR, a pathologic complete response. It's the highly coveted, what happened? The cancer is gone, like that chemo really worked. If you exercised and ate healthy, you had a 53% PCR, cancer gonzo, because of the chemo and your activities. Because if you just did the chemo, but didn't have a daily exercise regimen, nor did you eat healthy, 28% had a PCR. So PCR went from 28 to 53% because of exercise and healthy eating. In conclusion, my Beat It Breast Cancer checklist: eat a whole food plant-based diet, keep your BMI under 25, try to get up to 5 hours a week of moderate effort exercise. If you're super sweaty, vigorous, the definition is I can't talk. I'm not going to pass out, can't talk, but I can't talk right now. I'm working so hard. You can cut it in half to 2.5 hours a week and reach that near plateau point. Minimize or really eliminate alcohol. If you're going to drink, maybe just 5 ounces of red wine, and don't smoke. Manage your stress, have quality social connections in your life, screen through exams and imaging, give back, smile, love. I encourage all of you to visit pinklotus.com. There's a wealth of info on our website, entirely free. The breast center, you can access me. I do a lot of Zoom consultations. You can come see me at our physical brick and mortar in Santa Monica. The Elements store is online. I mentioned it with Cosmo Companion, but it really has a number of intelligently, uniquely formulated supplements and other products that are always non-estrogenic, always vegan, and really address the needs of women before, during, or after a cancer diagnosis. A lot of menopause-related products in there that are safe and non-estrogenic. But my favorite part of the entire platform is Power Up. This is our social community. Its whole purpose, written here: empowerment through community, events, podcasts, blogs, crowdfunding, and more. It's been shown that people who have breast cancer who report low levels of support have 58% more mortality than those reporting high levels of support. So along with support is our Breast Buddies program, entirely free. Newly diagnosed women are paired with those who have been there, done that, specifically age for age, stage for stage, treatment for treatment, as a source of friendship and support. My nutritionist, holistic BFF, Kristi Roth, and I have a monthly cooking show. Please join us. It's called Cook Live with Kristi and Dr. Kristi. I'm really excited to let you know that my summit is coming across the country this calendar year. Check pinklotus.com/summit for dates and locations, and sign up. It's a 3-day event where it's like, we have breakout sessions but it's really, I just talk so fast and I have so much more to say. It takes like apparently 14 hours of me talking nonstop this fast to say everything I need to. So I have a 3-day summit so I can talk slower and still get through most of it. I do have a book, Breast the Owner's Manual, and I think you would find it very informative, and it doesn't talk as fast as I do. I wish you all the very best of health. Thank you for spending time with me today.